I had to talk about this because I am actually involved, like pretty much everybody else, in the health insurance increase. I literally could not believe when I opened my letter. Of course, I got my letter late last Friday and my new packet for 2026 from my health insurance provider. My health insurance is quadrupling in price. I know. You're hearing this all over the place. What is happening? I had to dig into this more. I had to figure this out. I had to see what other people are saying about it because this is insanity. I called Neighborhood Health Plan of Rhode Island. That's who I go through. And the person on the other end of the phone could not tell me why the prices have increased because I thought it was just me. I had no idea this was going on. I really didn't. And the person on the other end of the phone said every single health plan has increased significantly. That was the word used, significantly. Yep, mine quadrupled. It's ridiculous. And that's not including the copays that have to be paid and the deductible, which is a lot. And it takes you almost a full year to reach it. Just saying. If you do, if you're pretty healthy, you're probably not going to reach it. However, we got some ideas in this video from people just like you and I, and let's see what they have to say.
I have been a skeptic from the beginning, but I think we're about to find out that the Democratic shutdown strategy was genius because the Washington Post just dropped a bombshell. So even before open enrollment officially begins, the health insurance marketplace is already showing people next year's prices. What they found out is shocking. And if you don't know about this, you need to listen because this is going to affect everyone that pays for health insurance. Marketplace health insurance premiums are projected to rise by about 18% next year on average. But that's just the start.
I said, okay, this isn't just me. No, it's not. It's apparently everybody.
If Congress lets the enhanced subsidies expire, the ones passed under the American Rescue Plan and Inflation Reduction Act, the average annual cost for people who buy coverage through the marketplace could more than double. And I'm talking about going from $888 this year, this is one example, to $1,904 next year. It's a 114% increase. That's not just a number, people. That's hundreds of dollars every month for families who already feel stretched thin. And it's not because insurance got greedy overnight. It's because lawmakers can't agree to keep a program that was already working.
Very true. That's what's happening. The subsidies are going away from what my letter had said or being substantially decreased. If we get subsidies at all, who the heck knows what's going to happen? And as I'm recording this video, food stamps will not be distributed to millions of Americans. Holy. I have no idea what's going to happen with that. But let's go and keep digging into the health insurance premium crazy increase.
I found out today from the marketplace that instead of paying $650 a month for health insurance for my son and me, I'm now going to be paying with my current plan $1,151 and some cents per month for my monthly premium. And my deductible is increasing from $1,500 to $4,000. I'm self-employed, so I don't have the option for employer health insurance, and I'm a single mother, so I don't have a spouse I can get health insurance from. And you would think if monthly premiums are doubling, surely my pay would also double from the health insurance companies. But unfortunately, that isn't how it works. And if you didn't already know, this is why Democrats haven't signed the bill. This is why they're refusing to sign, because they knew that people like me were going to see our health insurance premiums double without the subsidies, the premium tax credits.
You do have to wonder, really, what is the reasoning behind all of this? Clearly, it's because of money. However, by greedy hands going into really big pockets. You're destroying the basis of our country. You're destroying how people get to live their lives. What we're seeing is unbelievable. What is going on around us? Scary as all get out. And there's more.
Y'all tell me what y'all think. Have y'all seen the changes in what a family of four is going to have to pay for insurance costs between 2025 and 2026 when they have an income of $130,000?
That's the lowest cost. Family of four, $559.69 a month. Now look at this. The same family will have to pay $2,131.65 for the lowest cost option.
There's no doubt that we have a problem in this country. In 2025, a family of four making $130,000 got $1,200 and something of tax dollars to help them pay for their insurance policy. Well, they've taken it away in the big, beautiful bill. They're just not paying it no more for those people that makes that much money. Over 4 times the poverty level. You know, it all started when Obamacare come along. You know that, right? At one time, when people couldn't afford insurance, we had charity hospitals. We had a hospital that they could go to where we had doctors that was trying to do their internships that people could go to and get free health care if they needed it. But when Obamacare come along, they shut a lot of those charity hospitals down because everybody could afford insurance all of a sudden. But they was affording it because of our tax dollars. And if you don't know, anybody that was getting insurance through their employer, their insurance went to
And I have to say, when I worked in corporate America, I did look into Obamacare. And quite honestly, I didn't do it. I kept my corporate given health insurance, but it would have been cheaper for me to get Obamacare at that point in time. This is going back a few years now. And they say we have to have it. We have to have it. But how do you afford it? We're all in a rock and a hard place now, I think. That we're getting pushed back against the wall. What do we do? I have no idea. I have no answer, but maybe someone here has an answer.
So I just opened a health insurance letter telling me what my premium is going to go up to in 2026. Currently, I pay like $27 a month, Affordable Care Act or tax credit or whatever. Health insurance premium for me is going up to $511 per month. In 2026, I will be responsible for $511 a month for health insurance. I'm just going to be transparent about what my income is. So per the IRS, I have to pay myself a reasonable salary for the role that I do at my company. I pay myself $40,000 annually. It works out to be 40-hour work week, like $19 and some change per hour. Which, by the way, I actually do not think $40,000 is a reasonable salary for the work that I do. Which makes me getting paid lower at an hourly rate than my staff. However, I don't work 40 hours a week. I probably work 80 hours a week. So, I don't know, it's even less than that. All this to say, if I wanted to get on Medicare, the most I can make per year is just under $17,000 a year. I make too much money to be on Medi-Cal, but I don't make enough to pay for health insurance. If something were to happen to me catastrophic, like I don't know what I would do. I'm 45 years old. I need to be having certain cancer screenings, and if I could pay myself less, I would. More back into the business. Also, $40,000 is barely enough to live on in California. Most of my salary goes towards paying for gas in my car. It's gas and groceries is what I spend all my money on.
And gas and groceries, really. Gas, groceries, housing. And this woman is in California. I don't even know how she lives on $40,000 a year, to be completely honest. And our cost of living for all of us has just gone bananas. And speaking of bananas, I think that's what we're all going to be eating really soon, all the time, because they're probably the cheapest thing. However, I'm thinking, like, if I eat 3 bananas a day, that will be like $1.20. There you go. Now I can live.
Today, my job released our open enrollment. It started today. I am currently paying $240 every 2 weeks for health insurance for a family, correct? Now, that does not include my vision, dental, 401k, or disability. So when you add all of those in, I'm paying about $550 every 2 weeks for my entire family to have medical, dental, vision. I have disability coverage, and I also contribute to my 401k. We just got our benefits for next year. What I'm currently paying $240 every 2 weeks for is going up to $709 every 2 weeks. That does not include my 401k, my vision, my dental, my disability insurance. How can I possibly survive paying $1,500 just in medical coverage? They already kicked our spouses off of our coverage because they said if your spouse can get insurance through their job, we're cutting them off. So not only did you cut them out, it tripled. $700 just for medical benefits every 2 weeks. I'm not even talking about a month. This is bi-weekly. How
Insane.
is this? And I work in medical.
That is even more
How
insane.
is this fair?
If she
How
works
does this
in
work
medical.
for anybody?
How?
I can literally
How?
cry. I have a daughter that's graduating college next year. I have a daughter that's getting married next year. On top of that, we have to live. How? How can anybody live spending just $1,500 a month just in healthcare that doesn't cover our dental, that doesn't cover our vision? On top of that, there's a $2,000 deductible and a 20% co-insurance. So either way, anytime we go to the doctor, anytime we do anything, we got to come out of pocket. On top of what I'm already paying. When in the is this nation supposed to be great again? Because it's getting worse.
I agree with that 5,000,000%. And I think our medical system is already stretched to the max anyway, in terms of how much work is put on these people and the amount of, and I say paperwork, but nothing's really paperwork anymore. It's all on a tablet. But the amount of administrative work that they have to do when they see each patient is incredible. And my primary care physician, who I loved, we loved him, Dr. Bennett, he was great. And, he retired a few years ago because he goes, I just can't keep up with the paperwork anymore. I'm doing more paperwork than people work. He was at, near the end of the road anyway of his career, but he's like, I would have stayed, but I just can't handle all of the back end stuff that needs to be done.
All of the new insurance plans and pricing for the Affordable Care Act was released yesterday. And the data came back just what we've been saying it would. A health and research nonprofit called KFF had looked into the data and had forecasted how much they had thought the plans would rise. And they thought it would be around 26%. But what they found when the actual numbers were released was that most people's health insurance premiums were set to go up 114%. They told us that this is happening because Congress is set to not extend the ACA tax cuts. This is what the Democrats are fighting so hard for. There is nobody who can continue to absorb these rising high costs of health insurance. And if they fold, Yeah, SNAP benefits will come back, but come January, we will be in a world of hurt. And when I say we, I basically mean everybody that's not a billionaire. Struggling middle class, the struggling lower class. This is enough to collapse our medical system. Between this and the big beautiful bill, I'm terrified for what's to come for our medical system. My daughter is disabled, so we're in the medical system a lot, and we know that it needs vast improvement. But with everything that's coming, they don't have a fighting chance. We have to be real about this. We have a medical system on the brink. If I'm a Democrat, that's my talking point every single day. We're in the year 2025 in the United States of America, and we have people having to make choices between paying their bills, between eating, between being able to afford medical care. It's ridiculous.
What is anyone going to do? We have the food stamps debacle happening right now. And in just a couple of months, we're going to have a health insurance debacle like we've never seen before. How are you and I going to be able to get treated if something happens? And it is so scary because I know that the people around me, we try to stay as healthy as we can. We eat well, we try to exercise and just do the best that we can. However, things happen and life happens and you never know what can go on 30 seconds from now.
My name is Carla Zimmerman. I just retired in June from 25 years of teaching.
My name is Bartley Armitage. I've been in Eugene, Oregon for most of 45 years. I was a union carpenter for over 30 years. And still a member of the Carpenters Union.
Our current premium is $443 a month.
Through the ACA.
Through the ACA, and which is manageable for us, both retirees. However, it's going up to $2,224 a month. We are kind of in shock. That's without the subsidy. With the subsidy, it's manageable for us. We still live paycheck to paycheck, but it's manageable. The Affordable Care Act, we sort of counted on that in the interim period as retirees to sustain our health care. Without the subsidy, we honestly don't know what we're going to do.
Without the subsidy and with that kind of increase, it's like buying another house and trying to pay for two houses at the same time. Yeah, so we don't know what we're going to do exactly. We don't know how we're going to have some health insurance and be able to afford it on a monthly basis.
The thing that gets me the most is that both of us have worked our whole lives. I always had faith that our government would, when we retired.
The government, that our leaders would have a heart and try to find a way to help everyday Americans.
What I would say is this government should be about we the people, not about some.
Heartbreaking. Absolutely heartbreaking. I'm in that boat. We're all in this boat together, but the boat's sinking. And we'll see what happens and what people choose to do. We'll see what she's choosing to do.
All right, I'm going to need somebody or like several somebodies to de-influence me, okay? I keep seeing posts on here of people talking about dropping their insurance for the new year. And I'm really thinking it sounds like a great idea. Everybody's already paying like a ton of money for our health insurance. And then for some reason, if we do go to the doctor or the hospital or something, we're paying more money because we have insurance than if we were to go in there and not have insurance. So I'm paying for insurance just so I can pay more money? That doesn't make any sense. People are talking about setting up a separate savings account and just putting what they would be paying for insurance every week or bi-weekly or from every check and just putting it into this account and then having that account for any kind of medical needs. And I gotta say, it really makes sense to me because at the end of the year, you're normally not even having that much go on, knock on wood, but I don't know. It's making sense to me. I need somebody to de-influence me, tell me what's wrong with that plan and every in and out between it.
The only problem is if something truly major goes wrong within your body and you need a lot more care than what you had anticipated. The savings plan is not going to work. It just won't, because we won't have enough money to cover that. Insurance at least takes care of the big stuff. But if you can't afford the monthly premium that you have to pay, that we're going to have to pay, what is next for all of us? I don't have the answers. Maybe some of you do. It's going to get interesting. And I don't think it's going to get interesting in a good way. God bless us all. And I really hope something changes for all of us in a great way.